Nobody wants to sit in the front every day, huh? Like, good morning, everyone. Welcome to the Steuben County Board of Commissioners meeting for Tuesday, March 17th, 2026. Note that Commissioner Scheit is here live, somewhat, live stream.
Live stream. I just want to say good morning from God's country and the home of the Big Ten champs.
Not the national champs, just the Big Ten.
Not yet.
Stats.
Yeah, that was a good game.
Good luck.
Good morning. Are you representing the sheriff this morning?
Yes, sir, I am.
Thank you. We have 3 items from him. One is for narrative. Yeah, what generator,
Would you like me to?
battery oversight. Yeah. That's the only one I didn't talk to him about.
Sorry, I'm just like that for everybody. Morning, everybody. Yes, we have 3 items. First is a contract for Vertiv for a UPS backup system for our Fremont radio tower site, which is our prime site for the 800 megahertz radio system. UPS backup basically is a kind of a fail safe if we lose power, and it keeps things going until the generator gets spooled up and running, so we don't lose anything. Coming out of 1222.36100 $5,100 or $5,150, and that's I believe that's for the year, a yearly contract service agreement.
Questions? Move to approve. Rick, are you gonna participate from there, or do you want me to do those?
Oh, I'm sorry. I got to figure out which voice I'm hearing.
Sorry.
Yes, I'll participate.
Okay. Would you like to
I'll second.
Thank you.
Yes.
Now we'll work on this. Okay. Any further discussion? Hearing none, all in favor signify with aye.
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 Thank you.
Are you hearing me pretty quick or is it delayed?
No, you're in good shape.
Okay.
The next item is a chair lease for communications, a 3-year lease for all the chairs down there. You might expect to sit in them a lot, 24/7, 365. This will be coming out of 1235.30503 for $11,070 for a fleet of chairs. And
At least we started.
since, yeah, we started this. This is the renewal of that lease, correct? So with that, they fix any chairs, replace them as needed, and keeps our dispatchers as comfortable as they can be.
I will move to approve.
Second.
Any further discussion? Hearing none, all in favor signify with aye.
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 Third item.
Item is a request sale of equipment in South Fremont.
Move to approve. Rick, do you know what that is?
Say that again.
Do you know what that item is on the equipment for Fremont? Item 3.
Yes.
Okay.
Yep.
Motion.
No. Okay. I'll motion to approve.
Already have a motion. Need a second.
Okay, sorry.
You're
Second.
fine. We'll keep it organized. Okay. Any further discussion? All in favor signify with aye. Aye.
Aye.
Yes, sir.
Thank you very much.
Thank you. Brett, good morning. I'm here today to ask for permission to apply for the annual community corrections grant. Any questions on that? Move to approve?
Second.
You said that was about the same as it was last year, correct? Pretty close, yeah. Further discussion? Hearing none, all in favor signify with aye. Aye.
Aye.
I do have one other. Just got these yesterday. APV is trading vehicles down. There's a Ram and a Charger. We'd like to get them both. We have the money in our community transition fund.
Used vehicles, and this is what.
Correct. Yeah. So a 2017 Dodge Ram, 58,000 miles on it for 19,000. And then a Charger, 72,000 miles on it for 13,800.
What do you do with the other vehicles?
Our truck right now, it's got a lot of miles on it. It's got well over 200,000. That's the county's vehicle. So we'll go back to the county and the county can put it up for auction or reutilize it.
Same thing with the.
Same thing with the white Charger that we are currently using. It has around 145,000 miles on it. It's in good condition, so. We're just trying to get something with lower mileage and understood. So Rick, you don't have these in front of you, Rick, but they're looking at a 2017 Dodge Charger with 72,320 miles on it for 13,800. And they're looking at a 2017 Ram pickup with 58,434 miles on it for 19,000 to replace two vehicles that they have, and they already have a budget item for them.
You say they do have a budgeted line item?
Yes.
Yes.
Okay.
And then the two vehicles that they would be replacing would go back to the county for sale or reassignment. I explained that.
Yes.
Okay.
You're looking for a motion?
Yeah.
I'd make a motion to approve.
I'll second.
Okay, any further discussion? Hearing none, all in favor, signify.
Aye.
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 Thank you. Yeah. And I guess we'll instruct Aaron to reach out to see if anybody has any interest in them.
Will be the one for the
Department exchange, and then
put it up to us.
otherwise we'll put them up for auction. Mr. Howell, good morning again.
Good morning. Steve Howell, Northeastern Center. Appreciate the opportunity to address the commission today. Northeastern Center is one of 24 community mental health centers, or CMHCs, that serve the 92 counties in Indiana. We're the designated CMHC for Noble, LaGrange, Steuben, and DeKalb counties. And that means a couple of things. One is it means that Northeastern Center receives county dollars to help support our essential functions. And it also means that we have an obligation and a responsibility to provide a full continuum of services and be transparent about those services, as well as be a good steward of the dollars that we're afforded. Northeastern Center has been in the behavioral health treatment space for almost 50 years now, and our mission remains that we help individuals achieve emotional and mental wholeness through accessible, affordable, and quality behavioral health services. And we provide services to approximately 5,000 individuals a year. About 3 weeks ago, you should have received a report from me via email, and I have some extra copies if anybody needs them. It's about an 8-page report. We've been doing that report annually since 2018. There is a report that's required at the state level that is a 2-pager, but we feel like we want to provide a lot more transparency and a lot more information. That's why you get the report from me that you received. I want to hit on a couple of highlights, if I may, from the report. Be glad to entertain any questions or comments that you may have. So Northeastern Center is a private not-for-profit organization. We're governed by a 13-member board of directors. There's 3 members from each of the 4 counties, and there's an at-large assignment. So in the report, I list the names of the folks from Steuben County who represent the county on Northeastern Center's board. Page 2 of the report notes several of the community partnerships that we enjoy. And I've been at Northeastern Center for quite a while. I've been the CEO since 2019. And we really emphasize being a community mental health center. So those community partners are really important. I mentioned the continuum of services. Let's go into a little bit of detail with that. So again, primarily we occupy the treatment space. We do a little bit of prevention, a little bit of education, but mostly we perform behavioral health treatment services. So that is anything from folks that are severely mentally ill and have pretty dramatic diagnoses such as schizoaffective disorder, schizophrenia, bipolar disorder, all the way to the other end of the continuum. We have folks who are simply having problems in their marriage, or they have a substance abuse problem, anger management problem. So one of my jobs is to try to destigmatize what we do at Northeastern Center. A lot of people don't really know unless or until they need the services. So the folks that come to Northeastern Center are our friends, our neighbors, our family members. The services that we provide, we have 5 outpatient clinics, we have 4 residential group homes, we have a clubhouse, we have a hospital. We have recently built out our crisis continuum of care. I'll mention a little bit more of that in just a moment. We employ about 200 individuals currently. About 60% of those are what we call clinical staff. So we have 3 psychiatrists, we have licensed counselors, we have case managers, and we have a whole bunch of folks on the back end that help support those services. As I mentioned, we serve about 5,000 individuals a year, and specific to Steuben County, as noted on page 3 of the report, we served 1,073 Steuben County residents in fiscal year 25. Our fiscal year runs July through June, so that's what the report reflects. Out of those 1,073, there were 162 youth that we served, and that doesn't include school-based services that we provide here in Steuben County. A further breakdown, I won't go into the details, is provided on pages 4 through 6 about the referral sources, some additional services that we provide, diagnostic information, that kind of thing. And from the financial standpoint, funding for behavioral health is tough right now. It is for a lot of businesses. A lot of our consumers, our clients, rely on things like SNAP and Medicaid, and those things are kind of under attack right now, both at federal and state level. So there's a lot of concern about what individuals will do as these new requirements get put in to place around Medicaid. Last fiscal year, we operated at a 6% loss. We're about a $20 to $22 million company. This year through January, we're operating at a 12% loss. So we are working to control our expenses and find some alternative revenue streams. And the county funding is certainly very important to what we do, and we appreciate it very much. So center-wide, our total charity care is about $9 to $10 million a year. Specific to Steuben County, which again is mentioned at the bottom of page 4, it was $1.9 million last year. I also wanted to mention another aspect that's really important to me, which is our client satisfaction. And so on page 7 and 8 of the report, we typically hover around 95% client satisfaction. And in Steuben County, it's actually a little bit higher. Out of the 10-point scale, 9.85 are highly satisfied with their services. The state of Indiana also does an annual client satisfaction survey for adults as well as youth. That's the last page of the report. The MHSIP is the one for adults that they do, and they ask some basic questions about, as a result of services, were you better able to function? Are you better able to cope in society? So on and so forth. They compare each of the 24 centers against the average. So on the 8 markers for adults, Northeastern Center was above the state average on 8 out of 8 markers. And for the youth, we were above the state average on 4 out of 7 markers. That's part of the state report that's available at in.gov under the county provider reports. I also want to mention quickly that our crisis services, so we're moving towards the entire, actually nationally as well as statewide, moving towards a new behavioral health treatment model known as CCBHC, and it stands for Certified Community Behavioral Health Clinics. And a big part of that is a crisis continuum. So you may have heard of 988, similar to 911, but the 3 steps with crisis for folks that are in a behavioral health situation is someone to call, someone to respond, in a safe place for help. So Northeastern Center has, not only are we tapped into 988, but we also have an 800 number. That's a crisis line. We take about 2,000 calls a year on our crisis line. That is someone to call. We have a designated mobile crisis team. We were somewhere in the neighborhood of 14th in the state to get a designated mobile crisis team. They're now up over 20. The mobile crisis team sends 2 people out on site to help diffuse a mental health situation. And fiscal year 2025, the mobile crisis team responded to 30 calls through 7 months of this fiscal year through January. My mobile crisis team has responded to 98 calls, and they are there in less than an hour, a little bit over 48 minutes. We also have a crisis stabilization unit we call NEC Cares, which is a safe place for help. Last fiscal year, we had 719 admissions. Thus far through January, 7 months, we've had 977 admissions to that, which puts us on task to have close to 1,700 admissions. These are folks that would previously go to jail, or they would go to a hospital emergency department. They don't really need to be in either place, but there was no place else to take them. So it's a 23-hour crisis stabilization unit. So we're very proud of the work that we do. And again, that's a very important model of the CCBHC situation. So I think that is about all I wanted to present. I also, if I may, just wanted to acknowledge I've got 3 members of my team back here, Tammy Briggle and Seth Gibson and Dottie Fuentes, who are very influential behind the scenes with all the success that we have with treating individuals. So very proud to be the Community Mental Health Center for Steuben, and appreciate your time.
Thank you, Steve.
Appreciate
your report.
Thank you.
Thanks for helping people in Steuben County.
Yeah, welcome.
Austin, good morning.
Hey, good morning. I have a couple contract renewals. One is for the jail, it's for the generator. That's through McAllister. This is budgeted and it is a price of $3,236 for the year. That covers 2 PMs, several fluid samples, and some ATS inspections.
Any questions?
Motion to approve.
Second.
Any further discussion? Hearing none, all in favor, signify with aye.
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 Next one I have is for the judicial center. This generator came with a 1-year service agreement from Buckeye Power. Since expired, so I'd like to get these under the same vendor, McAllister. And that contract should be in front of you as well. Same services as jail. The price on that one is $2,407. That's also budgeted.
Nope. Motion to approve.
Second.
Any discussion? Hearing none, all in favor, signify with aye.
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 And my last one is through Police and Fire and Security. That is for the renewal for the judicial center. There are a couple holdups with the contract, some of the verbiage that we got from Don and his secretary. I'd like to see if I can get an approval for that, as long as I get that contract back and those changes have been made. That way I don't have to then keep it delayed. The price for that is $4,630.
Okay.
Fortunately, we always have a
Back in my favorite work.
draconian.
Yeah, once I get that, I'll send it back.
You want a motion? Yeah. I'll make a motion to approve after Don's review.
Second.
Any further discussion? Hearing none, all in favor, signify with aye.
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 Thank you guys. Have a good one. Thank you.
Okay, good morning. Again?
Top of the morning to you. I've got 2 quotes. First one is the cabinet, which we are running low on space. We're about almost 3/4 full. So with all the plants and everything that are coming through the planning commission, we're needing a new plant cabinet. So I figured by the summer, we're going to need it. I just want to get approval on that. And the second one is our annual film where we put permanent record all over reports and everything. Have that done. All out of the 1189 fund, yes.
Thank you.
You were reading my mind.
Yeah. Okay, move to approve.
Second.
Further discussion? Hearing none, all in favor, signify with aye.
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 Thank you.
Thank you.
Thank you. Morning, Becky.
Good morning. 3:30 on the agenda. I don't even know what order I have to do it in, but just jump right in. The first thing I have is an update on our website and our research that we've been doing to determine if we stay with our current provider And, or if we can combine with a vendor we're already have a relationship with, which is Granicus, which we use in the building department and the health department for permits and payments and things like that. And then lastly, Tyler, Indiana. I will give you the and I did email. They just highlighted the pertinent parts. And for Commissioner Scheib, I emailed this because I didn't
Yeah.
make it into the packet, so. So what we've done is tried to keep in line with the upcoming ADA compliance regulations that are being handed down by the state. And I think even at federal level, be able to get our website so it can be in compliance. So since we are, because of the size of our county, we're not required to do it this year, but we will be required to have it in process next year. So that was what precipitated our looking at the current costs that we have. So annually, right now, our current cost for our website is $4,600. In order to bring it into compliance, they want an additional either $2,400 or around $4,900 a year. And the reason why there's a range there is because they will tell you there's a problem, but they won't remediate it unless you pay more, which is the way it goes. So, or we can opt for an out-of-cycle redevelopment, which is close to $20,000, what we paid for the initial investment of developing our website. Granicus, the second one on the list there, it cost, right now, we're paying, I think, close to $20,000, maybe a little bit over for Granicus for what we're paying right now with the permitting and payments and things like that for the different departments in the county. In order to do a web portion, they're all very siloed. To do the web portion, they want $20,000 for the development and then $20,000 annually. If you can tell where my feelings about that. Tyler, Indiana, they've been in business for about 20 years with the state of Indiana, helping counties and municipalities create websites for them. Because we have an agreement through IoT, there is zero cost for development. It takes about 2 to 12 weeks. They look at your current site and they migrate it over into their new environment. There are several counties doing this. Their annual cost is around $5,000 to $6,000, depending on the number of pages we migrate. So we had a meeting with them, which we also sent it to Erin Shipley because she's our ADA coordinator for the county. My staff is very happy with the improvements that would come if we went with Tyler, Indiana. The other reason we want to go with it is because we moved to the in.gov domain name. We're in the process of moving to that. It's going to provide us better security. The state of Indiana's IT, IoT department will look over and make sure that we're not getting hit with fake sites. When they type in Steuben County in.gov, they will go to that correct site. So, so people will be able to know that they're not going to get spoofed. So the only other thing on the second page or the back of this page is that in cooperation with our EMA director, he helped us submit a grant application for the DHS Department Homeland Security Program grant to help with this cost. So because of the shutdown, you'll notice the asterisk there, the award notifications are delayed. We should have heard something in the month of February. So as with a lot of grants, you cannot sign to do this project before the grant is awarded. So because it takes about 10 to 12 weeks to do this project, I am asking for permission to explore the possibility with Tyler. And if the grant is awarded, we will use those funds for this project. So I'm looking for, the recommendation is that we get to explore the Tyler option for the county to move our website in that direction. I'd like to wait 2 months and hope that we get an award notification so that the cost will be covered. If not, it's still well within what we're already paying this year. So it would just be an extra money by the time we were able to do that. So that's my recommendation. I would like any discussion or any questions you have.
We currently with Revised, we have a contract that we're obligated under
Yes,
through what period?
January of 2027. And I would have to give them notice probably in fourth quarter of this year if we're not going to stay with them.
So this would be something we develop to begin using.
In January, December, January.
Okay.
This coming year.
Okay.
It's just a very long process. Well, I shouldn't say really long, but it's long enough that I need to plan ahead.
Sure. Questions?
I was on one question.
We have a motion to allow her to proceed with exploring.
I will make that motion.
I will second.
Does anyone have any further questions or concerns? Hearing none, all in favor signify with aye. Aye.
Aye.
Thank
Thank you.
Thank you.
What's that? Rick?
They just said thank you.
I said thank you.
Oh, okay, thank you.
you. The next thing on my list kind of came up last week. I'm making a request to ask if I can get an IT credit card, department issued credit card to address some of unexpected expenses regarding servers or equipment that comes up after hours, or where we need to move more quickly than we do with our vendors that we already use or that have like the net 30 terms. This happened last week. It has happened other times. I've been able to work around it. But right now I have to follow the process that's in place of contacting the auditor's office, getting, or sometimes verbal approval as well to use the credit card. And like this happened in the evening and over the weekend that I was scrambling trying to get net 30 terms with the vendor that we hadn't used before because the other vendor that we typically use did not have the equipment. So my request is to be able to use this for emergencies and follow any of the approved processes that are already in place internally for things like that. Because the cost of server equipment and server items, like what I was needing to buy were hard drives for 3 of our servers. They needed to have a primary drive, backup drive for each of them. So there were 6 hard drives. I had to buy caddies that they would slide into the servers, things like that. It's expensive. So that's why I'm asking for the credit limit of 8,000. It can't really be, in my opinion, I don't think it could be lower than 5,000, but I wanted to ask commissioners for their feedback and discussion on that, if that's a possibility for the IT department and only to be used at my approval or my use only.
Can we put a policy?
No, we have a credit card policy in place for the use of the credit cards. But you guys have approved each individual department if they've asked.
Would you under for a name then? It would have to be great.
Yeah, and we don't see, they handle everything.
Right.
And then it's the submission of paying the bills and everything, they gotta make sure they get those in on time so that we don't pay any penalties or fees. Yep. Missing anything in there?
Questions? Motion?
Okay.
I don't really.
Concerns?
I think it's important, this is one of the most important departments we have, so I think it's important that he has the ability to
Secure.
secure, yeah.
I agree.
So I think it's important that she needs something done quickly, given the tools to do that, so I would make a motion to approve.
Oh, sorry.
Rick, are you able, we kind of were quiet up here discussing that. Were you able to hear us okay? Just curious.
Yes, yeah, it's picking you up pretty good.
Perfect. Thank you. Okay. Any further discussion on that? Okay, you're all good with the amount of 8,000?
If Nikki's good with the 8,000, I think it's not a bad number.
Favor signify with aye.
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 Okay, last thing on my list. We have our cybersecurity insurance that we renew every year. Usually it's in August. I reached out to our provider for that and asked him, this is something that I did the last place we worked. We actually periodically, it wasn't every year, it was every couple of years, but with the changes in cyber incidents, I asked him if he would come and give a 30-minute overview of our coverage for our cyber insurance, as well as trends that they're seeing within either public sector or just in the clients that they work with. So what I have asked, and he said he's willing to do it, I just need to get dates. So I'm just asking, I asked him to include the auditor and at least one person from the commissioner board. It can be one person from the council as well. So I'm just asking if we could coordinate and find a date. It can be, after a commissioner meeting or it's just informational. But we found the last county I worked at really informative. It's something that we pay every year, but it's a good thing to have an overview of our coverage and how we could even improve down the road, looking ahead. So we can you can email me back 2 or 3 dates. That's what would be helpful to him.
So that's something we're happy to do. We need to make sure is if we have, if there's more than 2 of us present or more than
Right.
4 council members present, then we need to make that public notice.
And that's what I was asking, if you want to have all of you, or if you want to have a representative from each board.
Let's see how the dates work out.
Yeah.
Okay. And then if Abby or Kelly could let me know if we do have more, and if we're doing a public notice of the process, you want me to follow.
I guess maybe the first question would be send something out, how many would be interested in listening to it or hearing it, then you can determine whether or not you have to have a meeting.
Thank you.
Okay. Anything else?
That's all I have.
I guess the question on that would be cybersecurity, would it be better to have just individuals or not have the public meeting? Or,
That would not be a bad idea,
so that's probably. the way
especially
to
if you
go.
want them to speak to our
Right.
coverage. Yes.
Something like that, non-qualified for an executive session?
Probably would.
Because of the privacy part of it.
Probably would, yeah, you certainly don't want to have it available online, as a public meeting.
Executives. I would too, just make sure.
Yeah.
That falls underneath that.
Yeah.
But I would assume as well.
Yeah, if I could just get it done well before August, that way if there are any issues, I can take care of them.
Very good. Thank you.
Thank you.
Thank you again.
Andy, good morning. Good morning, Commissioners. How are you guys? Got two items on the agenda for EMS today. First one is for you guys to review and approval of the Steuben County EMS Special Operations and Rescue Team, or we call SORT. What SORT's going to be doing is going to be comprised of 2 paramedics, EMTs, and then potentially 2 part-time employees that we currently have on staff. Our goal with that is to be a rapid coordination and response during complex emergencies, advanced medical and rescue capabilities, operational medical support with partnering agencies like fire departments, and enhanced disaster preparedness and mutual aid coordination, and then also train these individuals at a higher strict qualification and certification standards. The goal is to provide Steuben County with a better coverage during mass casualty events, also large scale public events, and then water rescue recovery type of situations. The more high acuity runs that do need those specialized training. Most of our funds will be kind of coming from public donation, buying or getting the public input from that. A few funds that we would utilize to help get us started would be one of our training funds. Last year, we had access of roughly $7,300 of our training fund. We use a small portion of that to kind of start us getting some education done. And then also our second medical supply line item, which is 2120-2. Last year, we had access of almost $11,000. So we used a little bit of that to buy some specialized equipment that we would need to get that started.
How does this differ from what you currently provide in terms of that?
So what this would do, just gives our individuals a bit more training with the dive team, with hazmat, and then also with some of the like drain rescue situations that we have faced in the past. Most of the time that we relied on the fire departments to get that training done and rescue those individuals by having paramedics and EMTs up in there doing those trainings and those rescues. We're able to provide point of care to a lot quicker, and it just gives us more incorporation with the fire departments for future endeavors that we're looking at through the county and all that.
Does that, if you use some of those funds for the expansion of this service on the training side, does that give you adequate funding though to keep everyone who we have employed?
Yeah, correct. Yeah. It doesn't really, it won't truly impact what we currently do. Again, like last year, we had excess of those. I wanted to make sure when I went back to look at, make sure we did have enough padding for that. But again, most of our funding is going to be coming from the public stakeholders, going out to different corporations, showing them what we can do, and get some funding from them. And that would go into our donation line items. I think we've just distributed as needed for that. Then on that proposal I sent you guys, it does give a full layout of kind of the process we're going to use for the actual implementation, the letter of acceptance, the requirements they're going to meet to be brought on the team, and then the requirements for the certifications as time goes on.
I did look at the PAT requirements. Aaron, have you seen those?
So the physical agility course, what we did, it's very similar to what law enforcement uses with the ILEAL certification. So I took ILEAL and then a CPAT test for the fire department and metered into one physical test for us. I can actually.
Will they be paid while they're doing these agility tests and everything, or is this on their own?
They would be paid for the agility test, just for compensate their time because they are currently employed with us. We're going to go with just employees that we currently have in-house. We're not going to bring anybody else on board that's not part of Steuben County EMS currently.
So this would likely be overtime compensation.
A small portion, yeah. So most of the training I'm hoping we do while on the clock, but there will be some extra compensation that would.
Andy, you mentioned public donations to help pay for this. Unexpended training funds and unexpended medical supply
Yeah.
item line from last year.
Well, it's this, we have that same line items this year, but I was looking for the funds from last year, what we used in 2025. And that was the excess that we had in 25. But this year, we still have those same line items.
So it would come out of those line items, not what was left over from last year,
Correct.
because we didn't have any.
Yeah. There was no full, yeah, it was just out of this year. I was looking at last year's line items and what we had excess left over, kind of gauge what we
Okay.
can pull it from.
All right, thank you.
Anybody else have thoughts besides me?
No, well, yes, sorry. I think it's definitely a good thing to do. Yeah, I think there's some questions about the payment, how that's gonna work with training.
So
Yes, well, Mike, you're here, so how does that work with your department when we're doing training and stuff? You guys, is that usually all done on the clock?
We try to do it when people are on their regular time as much as possible. But unfortunately, depending on how many have to be trained, what the training is, we do incur some overtime sometime, but the goal is to limit that as much as possible.
But this is pretty much in line with that same model. Like,
Yeah, the best example is we set all our state mandates that we have to have every year, and we have Act Out come up, and it gets everybody done in about 2 hours. We do everybody at once. So most everybody was on duty, but some people it was their day off. But it's just, it's a quick 2 hour, which that does add up, and you have multiple people, but yeah, we try to limit the overtime as much as possible.
Are we currently sitting on the overtime budget?
right now, we're right on track. We haven't really had a huge influx on overtime until probably this month. We're gonna have a little bit of an influx in overtime. Summer's starting, so we have a lot of people going off and off on vacation right now, April. But looks like May, we're gonna be bringing one of our part-timers back on for full-time for the summer to help. He's a college student here, so that will help us cut some of our overtime budget off.
Trying not to put my council hat on here.
It's
hard, isn't it,
I
Rick?
hear you.
No.
You two guys have one, I know.
Yeah, I think you still have the same thought process.
Yeah, I would like to see what those numbers would, you're not talking that many. 6 total people.
At most, and that was on the high end of, getting everyone on board. If at the beginning, if we can get 1 or 2, I think that's where we're gonna be. The ultimate goal is to be 1 or 2. Then build as years go on up to that total of 6. But I think currently looking at our current roster, and kind of our PAT test and all that, 1 or 2 is kind of where we'll be starting at.
That's how many you think will actually, try to do the.
Yeah,
program?
so far, just by putting the games on, I had like 3 who'd be interested in it. So,
Okay.
once we do the PAT test and all that,
So we're not having like 20 people.
yeah, we won't be doing, yeah.
Is this such specialized training that we need to be concerned about longevity afterwards. In other words, we spend the money training somebody and then they leave 30 days, 60 days, 90 days later.
Yeah, I will be honest, a lot of the training that we're going to be doing, a couple individuals who have already sort of interested in it are already fire-based in our county. So they have some of that training already in-house, ready to go. So mainly what this is going to do is kind of start to mirror fire EMS kind of together. So we're getting that training done. So the initial training cost will not be super high because they're going to be trained. Most are already at that level, the operational level, we'll say.
You know, I'm all for training people, but I really hate to see us spend
Correct.
$6,000 or $8,000
Correct.
training somebody.
Yeah,
And then
so I mean,
60
training,
days after they train.
yeah, so our first year, the big requirement that we had was TCCC, Tactical Combat Care Casualty. We use this for active shooter events, mass casualty events. That cost is less than $100 per class. And hopefully, after I take the class coming up, I'll get my instructor license to be able to teach it myself. So then that cost will be greatly reduced. And then some of the higher like rope rescue courses, DHS puts those on. So those are actually free for the county and all that. So we're going to try to utilize a lot of the courses that are already lower cost or free or paid for by the state to help get us trained.
You spent a little bit of time working on this, haven't you?
Yeah, I have. Yep. So, myself, Lee Greenmeyer with EMA, and then Ashley Fire. We've kind of been talking about this, it's kind of brainstorming. We've kind of figured out paths of where we can get training accomplished. And we're not just training our individuals, but the county fire departments as well. So hopefully incorporate everyone in the area to boost our level of preparedness.
Direction you guys want to go?
I guess obviously the concern is we could train somebody and they could leave. I do think we have other departments that are in that same boat. There's obviously good as well on some of their training. It's just
Special stuff.
Yeah, that's kind of what this is. We are a unique county with all the lakes, and I think the more preparedness you can have with some of the stuff, that the better off our department could be. So I will make a motion to approve.
I will second that.
I was about ready to do it for you, Rick.
I have reservations, but I like where you're going.
We can always draw back, I guess.
Right.
Yeah, and again, as this process goes on, I will keep you guys all informed and give you guys kind of like quarterly reports of how it's going and all that. So.
Any further discussion? Hearing none, all in favor signify with aye. Aye.
Thank you, John. Second thing on the agenda is the reimbursement program for paramedics through school VMS. Aaron and myself kind of modeled the one that's already in place for IV Tech. School VMS is just another avenue of paramedic training. The big difference between IV Tech and school VMS is the actual college credits. IV Tech requires additional courses, extra courses. School VMS is a little bit more reduced for what's required. IV Tech has some additional courses, clinicals in the hospital and all that, whereas school VMS is just the bare minimum. This is usually geared for individuals who are already in EMS, who are already working in EMS, so they have that knowledge already. Currently, we have two employees. One was full-time, and she dropped down to part-time. She took a leave for medical reasons. But the other one, we do have full-time on staff. He's currently in the program and getting ready to finish midsummer. I did attach his invoice to the paper you guys have, and roughly the tuition is right around $8,100, give or take. I think each year kind of goes up a little bit due to inflation.
contracts required for terms.
It's the same, it's the same retention, same requirements as we had with Ivy Tech with school EMS for employees once they sign that.
You're good with the wording and the way it's presented?
Yes, I messed around with that and sent
Yeah.
it over to.
Yeah. I think we adjusted a little bit, make it a little bit more
Yeah, the key
streamlined.
differences between the two programs when it comes to the reimbursement of the tuition costs is Ivy Tech actually would invoice the county in arrears. Whereas this, the employee would pay for it upfront, and once they prove that they passed, then they would be eligible for reimbursement.
No, that was our concern, I think.
Yeah.
Fast, we're good. I think. Motion.
Yes.
Move to approve.
Second.
Discussion. Aye.
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 Thank you, John.
It's ready, striker cactus.
Yeah, Andy,
Andy.
yeah, third item on that.
Striker cactus.
No, so we took that off, with the Stryker cyber attack that happened last couple of weeks. They're completely shut down.
Okay.
So I found a workaround, kind of quick discussion on that. With us applying for a controlled substance license, the DEA license to combine narcotics. In the future, we're going to have ways to dispose of unused narcotics. So currently, we hate to say it, we just waste it in a sink or on the ground, which by DEA standards is not legit. So our workaround right now is I just bought bottles of solution that actually neutralize the narcotic. We're gonna keep those in the trucks for the time being. Once Stryker gets back with me about cost of a cactus unit. A cactus unit is a large controlled lock box that actually absorbs it and neutralizes the narcotic. This workaround is gonna be a little cheaper for right now and just utilize that.
Does the hospital have anything that maybe we can?
So they have a cactus machine as well in the ER, but we can't use theirs.
This might fall under that opiate, the actual restricted.
So once we do bring on our controlled substance license, we are can really restrict on things that we can do, we can do things with. So with them, trying to keep everything in-house, with this license, I'll be in charge of actually purchasing narcotics, securing them, locking them up, then distributing them, and then any waste will have to go through myself, and then keep it all in-house. So,
All right. Thank you.
yeah, no problem. Yeah, that's fine. This is just
We'll get to look at some
Don
concrete.
Regular, Steuben County Government. Wanting to propose
like I said,
adding concrete between the
law enforcement.
hog barns and shoreline.
Morning, John.
You should have, we sent it in to you.
Yeah,
I did.
We did get some bids. One was from Millennium Concrete, one from King Concrete. Now King only did the first phase, but the Fair Board went ahead and last week and decided to go with the bid of Millennium Concrete. Now we're just looking for your approval. We can get this taken care of, and we'd like to have it done before June 1st of this year.
The issue of drainage.
They know there's a drainage right there.
Yep. We're also putting more gutter on the side of the hog barn, which will go into a drain system. And, there is drains out there, so just to be tying into them.
Any thoughts?
No, it'll definitely help cut down on some of the mud and trafficking around there when they do have rain events. It is gonna push a little bit more water down toward calf barn and like that, unless you're gonna retain that up there, John, and anything.
They have planned on trying to get that pushed away from there.
Yeah,
They talked about, Gary Shuff was talked about possibly moving it towards the backside, down toward that rain gutter area. So we are going to make certain that we don't have any of the water problem.
yeah, I know it's been an issue there every time it rains during the fair, so.
Correct.
And it'll be dry until the fair comes and it'll rain, so we always know that.
Well, this here will also help for the show area and keep it clean and through there, and then also help for people walking down through concrete. They'll make it a lot nicer in there. We're also looking at possibly in the future, putting the canopy above the eating area, around where the trailers are. That give us some shade. So just trying to move forward, make it a little bit better. I'm just looking for your approval to proceed.
I will move to approve.
I'll second.
Any discussion? Hearing none, all in favor, signify with aye.
Aye.
Thank you very much.
Sorry, Andy, I'm making you do all the heavy lifting there.
I'm used to it.
Is Chip here?
I don't know. I think so. Yeah.
No, Chip is down here.
Oh, that's right.
Oh, that's right.
Is he, Chip, you in there in the room? No? All right.
No, he's not.
He could have presented.
I haven't seen him yet. I did talk to him. He was supposedly heading down this way at 7 o'clock this morning, so.
Yeah, you get Adam join you.
No LPA voucher. That. And then- Spot. Scoot on down. Yeah, lots for us.
I know.
Into other businesses. There we go. One of the other business. First item is the March 6th payroll of $611,472.80.
Make motion to approve.
Oh, there you go. Second.
Got in front of that.
Yeah, you did.
Any further discussion? All in favor, signify with aye.
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 Okay, we have some minutes to sign. You'll have to take care of those when you return, right?
Okay.
Yeah.
So the 2026 Fremont Comprehensive Plan.
Yeah, I think we have to approve everybody's.
I haven't seen it. Have you?
No.
It was in that email, yeah, it was attached.
It was?
Oh, it was the,
Because it was like over 100 pages.
yeah, it was,
I was gonna say, it's in our,
yeah, it was in the packet. So.
in the packet. So question is, why are we needing to approve Fremont's comprehensive plan?
ETJ.
ETJ.
Because of the ETJ?
That was we'd have to do everybody's, right? If anyone has ETJ.
Correct.
Like you would do it all.
When they do a new one,
Right.
you have to approve it.
Yeah.
Why don't we just do away with all the ETJ so we don't have to worry about
I think you can't take away, I think you can avoid additions.
it? I think we can take away.
Well, there's a whole process to go through, but
Well, yes, there is.
it's not just approved, motion to approve HOA. But this is a comprehensive plan. This is just a guide.
Right.
It's not like you're setting zoning or anything else.
It's, yeah, it's what they have to do to, get some of their stuff done. I will, I'll make a motion.
I'll second. Did you hear my second?
Yes, I did. I just, I'm looking.
Oh, okay. Sorry, I wasn't sure you heard me not. I do think it's something we need to take a hard look at in the future though, on these comp plans, if they're including ETJ. It's been an ongoing issue that needs addressed.
First and second, any further discussion? Hearing none, all in favor signify with aye.
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 I'm gonna abstain. I missed that part. Okay, uniform conflict of interest. Mr. Laughlin. Mr. Press. Like that's the only two right now, correct?
Yeah.
Okay. I'll make a
I
motion
was
to
gonna say,
approve.
motion,
You did make a motion, Will?
I did, yes.
I'll second.
Any further discussion? Hearing none, all in favor signify with aye.
aye.
We have minutes from March 3rd meeting.
Make a motion to approve as presented. Second.
Any discussion? Hearing none, all in favor signify with aye.
Aye.
Use electronics or some IT work. 1138, 262570.
Move to approve.
Second.
Any discussion? All in favor signify with aye.
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 Is this our last one of these probably for Baker Tilly?
No.
No, we're gonna have to do that every year of the bond.
Mhm.
Every year of the bond.
As long as we're still earning interest, we still got money in there.
Okay. All right.
For arbitrage,
Mhm.
yeah, already did.
Go ahead.
Approve.
Second.
Any further discussion? Not all in favor signify with aye.
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 That invoice is probably for about half of the interest we were. Monthly financials, alls we have right now is, we got both. Any questions on either of those?
Move to approve. Oh, I'm sorry. You reviewed them.
Yes, I'll second that.
Any further discussion? Hearing none, all in favor signify with aye.
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 We have the
clerk's report.
Make a motion to approve.
Second.
Is that an approval or just a review?
Review.
Review. You want to correct that?
Yes. I'll make a motion that we were provided the clerk's report to review.
Second.
Any further discussion? Hearing none, all in favor signify with aye.
Aye.
Aye. Item 10's been removed from the agenda for today. The approval of the ordinance update. Which I get paid out of.
I'm gonna have to ask Ian because I don't remember when we usually made it, which one. Yeah.
Publishing.
She's gonna look real quick. It's paid out of contracts. Attorney's fees,
I'm just curious.
that's where we've paid out of it before.
Any questions on that? Comes out of attorney fees, Rick.
Okay.
You know how those guys are.
Yeah.
You've heard of them all.
Well, we like ours.
But we like ours. Yeah, we do. All right, any motion?
Make a motion to approve.
I'll second.
Any discussion? Hearing none, all in favor signify with aye.
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 And finally, Kelly seems to want to pay the bills for the month, so.
Yeah, people won't want their money.
All right, now I'll make a motion to approve the claims, $624,180.32, and items A and B.
I will second.
Any further discussion on those? Hearing none, all in favor signify with aye.
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 Okay, Kelly, you got a couple of other things for us?
I do. I had asked Donna to come up in a council meeting, the ARPA committee no longer meets, the money's flowing at the end of this year, we need to dissolve that committee. They're asking about dissolving, and Don said if the commissioners form the committee, then they can move to dissolve and vote on it. So if you guys want to dissolve that, you could do that in this meeting. If you don't want to and you want to wait a little longer, that's fine. But I did have that, it was brought up at the council meeting.
So we do have have everything appropriated and taken care of.
It'll be gone fairly soon, probably, because we're,
And there's no chance that there will be something left over that we need.
money wise, money will be gone.
Okay.
And I still have to do the reporting, of course.
When do you think the money will be gone? Just,
I'd have to check with Aaron and see where we're at, or Ian
I mean, you
might
think
have
it'd
it
be-
also.
next couple months.
Oh, yeah, probably.
Was there still money set aside for the audit?
Yes, we still have that.
Why don't we wait until those are done?
That's fine.
I thought that's what.
Yeah.
Okay,
Just in case.
Yeah, just in case we need to
have a meeting. I hate to have to do it again.
When are they gonna do the audit?
I haven't heard from them yet. For this year, I don't know. And then we will. Assuming we'll be audited again then next year. So probably have to
Can encumber what's
encumber
left
those
for
funds.
next year.
Mhm.
Would that be permissible under it, or do we need to?
I'll ask the state board of accounts.
Say, do we need to use it this year, whatever's left, and then
I'll ask them.
have an additional for next year out of general or somewhere?
Okay. Next thing I have includes Don. Charlie came down and got, yeah, for Don, yeah, I got one for Rick too, I can put it in your mailbox. But Charlie presented an invoice, from Haller and Colvin, attorneys at law, regarding the appeal filing. I didn't want to pay this until I was sure that we were good to go ahead and do that. I wanted to make sure there wasn't any type of double billing, because I didn't know what Don would be billing for versus these guys.
Well, my billing is, first of all, the plan commission approved a 50% of the cost of the appeal up to a maximum of $10,000. Bob Ehrman is preparing the brief, and my sole billing will be to review the brief. And I'll probably have less than 3 hours involved in the appeal. But Bob's kept in touch with me, and we've had a few emails back and forth. So this was approved by the plan commission. I think it's a legitimate bill. Should be paid.
Okay. They are telling us only to pay 1/2 of it.
770.31.
Correct up there.
Mm-hmm. I just wanted to run it by Don and you guys before Charlie was concerned, and
It's a good idea.
You want a motion to paying it?
yeah.
I'll move to approve.
Second.
Any discussion continued? No? Hearing none, all in favor, signify with aye.
Aye.
Here's the statement. Okay. The next one was just to make, we have this also. Once one, we'll put one in Rick's box. This is just to let you guys know that we heard from, Jeff regarding, our insurance, our liability insurance binder, just to let you know, there's gonna be a 6.35% rate increase
For next year.
for next year. Yep. So that's just kind of an FYI.
That's from our insurance from, and that'd be Bliss McKnight.
Yeah. Yes, it is. It is
How much is it going up?
6.35% rate increase.
Just talked to one of the representatives last night, and they thought we were doing everything so good, I wasn't expecting that much of an increase.
Are they still down there?
I'm gonna find out.
I was told that was a good percentage because
That's what I'm wondering, what's the?
others experienced a much higher percentage increase?
If the average rate's, 12%, are we, I don't know what that answer is, but
That's 6.1,
3.5.
3.5.
0.35.
You want to scan that, email it to him, so he has it there, and he can.
Yeah, I'll scan it.
Maybe question somebody,
Maybe scan it.
since you're there.
Yeah.
The last thing that I had that I wanted to bring up was I have received another email regarding the national opioid settlements. Will, you had gotten something also.
I sent that to you.
Yep.
That's
Now,
something we need to execute.
well, I reached out to the Attorney General's office, same as I did the last time, just to make sure that they're legit before I do a DocuSign. And it is, this however, is not one that the state of Indiana is participating in. However, that doesn't mean that we can't participate in it. So I reached out to a lot of them. Some of them they've already signed up for. They did want to receive this. Some of them said, hey, I don't remember seeing that. Can you forward me what you got? So I did. So it's up to you guys. If you would like me to go ahead and sign the DocuSign paperwork, I'm more than happy to do that. I am not sure how the reporting and all the requirements work on this because it will be a one-time payment once everything is settled. Because the state is not paying us, I don't even know if I have to go on and do an annual report. I don't know. I'm gonna have to ask the state board of accounts that actually. But, and I can't tell you now, we don't know yet.
One-time payment. and it's-
One-time payment.
Say whether it's restricted or not, or is.
Nope. There really wasn't a lot of information on this.
We already have a set up or account set up for this
We did,
to put them in, so.
we did. It's a separate one. This one's called Six Remnant. And there were 6 more companies.
I know. I don't see anything for you or anything. Happy with that. At least.
If you would like me to sign it, if you want to give it some more time, we have to, what was the date on this? There's a deadline date.
May 4th.
So we have a little bit of time yet. Yeah, Monday, May 4th.
Let's review this.
Okay.
We can bring it up there.
And then maybe you'll have more, other
I might have
auditors.
other auditors by that point.
Yeah.
That is all I have.
Executive session.
So we have 2 executive session memos, one from February 27th, one from March 3rd. Just need a motion to approve those.
Move to approve.
Second.
Any discussion? And all in favor, signify with aye.
Aye.
Yeah, he's making
I am, I gotta keep it separate from my other stuff, so. Next up.
Yeah, don't be taking them signing papers, so this is us.
Anything else?
You just blame it on me keeping it.
That's right. That's in your spot.
Yeah.
What time is the April 9th?
9 a.m.
What is it?
9 a.m.
9 a.m.
I was gonna attend that with you gentlemen, if that's okay.
Yeah. Did we get a,
Can we record that if I take a tape? No?
Well, you can record your session. It's just a discussion between you and I don't know if the mediator will permit it or not.
Okay. Well, I'll take it with me, and I guess if he tells me
And
no,
I'm gonna have to get permission for the mediator for you to attend.
Oh, okay. Do you want me to attend? Guess I don't have to, but
I think he'll grant it, but I do have to get permission for an additional party to attend.
She's in stuff. Write the checks.
Right. I have an ICT board meeting. Any day.
I'll contact you and see about the recording and the attendance. I don't think there'll be a problem.
Okay, thank you, Don.
Anything further? All right, we'll stand in recess.
2 o'clock.
Yes, sir.
Okay, I won't be back for the 2 o'clock,
That's fine.
No, that's fine.
unless you need me for anything.
No.
Aries.
Especially with Elizabeth Knight.
We all.
Yeah.
We're still.
Oh.
I was just curious, how through the years, it's got less and less, and I would just.